to name the structure, possibly name the tissue that forms the structure, and then you're also going to have to include left or right. So let's start with left or right. And so we have two possibilities. We could either be like this, or we could be like this. So that's going to be your first thing to figure out. And so we need to recognize the femur from the tibia. And when you look here, yeah, you see the tibia, you recognize the shape already of the tibia. It's flat, whereas the femur, the distal end of the femur, has these two ball-like condyles. So is this the femur or is this the femur? This is the femur. So we have the two condyles. Okay, and here's the tibia. Well, it's a cow, you know. It's surprising. We've had buffalo before, and they're much more delicate and smaller, thinner, because they're game animals. These guys have been bred to be. Because if the muscles are big, the bones are going to be big. We breed these to get more muscle. Yeah, plus all the hormones. Okay, so now if we're going to look at this, we can tell if this is a left or a right because we have a clue, right? Yeah, the fibula is lateral, so is this a left or a right knee? That's a right knee. But you know, I get this from the butcher shop, and they always take the fibula off because it's so sharp and wiggling around. They don't want it to be flying off and flying around, so they take it off.
That's a left. The left leg?
And this is a left one, yeah. And because on this lateral condyle of the tibia, there's always a spot for the fibula to tuck under. So you should be, even though we don't have the fibula here, you should be able to recognize left from right on this. This is a left knee. So everything, so now we know left, so we're going to name everything left something. And also we know the names are almost always medial or lateral, right? Medial or lateral condyle. And then we have everything has the name is the orientation, and the medial and lateral collateral ligaments, medial and lateral condyle. So we have to know medial lateral. So everything over here is lateral, everything over here, medial, and then anterior, posterior. Okay, so we can clearly circle right. Okay, so so now
Is it a left or
that's a left knee, because here's where the fibula goes. So this is lateral, this is medial. Did I say it backwards?
No.
Lateral, because the fibula is lateral, this is medial, so that's
It just looks the other way.
Is the knee still here?
No.
This is oh no, it's not. Okay, this is the patellar ligament, and actually we have a little bursa in there that I can stick my finger in. But it's open. It's not, the bursa isn't something you can actually take out and say, oh, there's the bursa. Okay, because the walls of the bursa I'm touching the synovial membrane here, and the fluid is gone because it's cut open. So, it's attached and embedded in the surrounding structures. And where's the joint capsule? Well, it becomes part of the tissue that's covering this, the ligaments, okay? But that would be a bursa in there. And then they didn't talk about that bursa, but there's also another one up here that they did mention. But we're missing all the quadriceps. We're missing the quadriceps tendon. And then the patella would be here, embedded in that tendon. And then this part, we call this part of the tendon, we actually call it a ligament, the patellar ligament, because it's bone to bone, patella to tibia. So that makes this the patellar tendon. Ligament. Okay, now this is a ligament too that's been cut, and I just left it here so you can check it out.
I know what that is.
But this is something different. We're not learning this name. What is it called?
Is that one the anterior?
No.
Okay.
Those are inside. This is something else, and this actually this could be a ligament, or it could be, and I don't know the muscles here. It could be a tendon.
Because it looks like from the front, from that angle, it looks like you can't.
No,
see
we'll
it.
see the
Okay.
cruciate ligaments. They're in here still. Okay, so let's go from external to internal, from superficial to deep. And so we're going to start with the collateral ligaments. Okay, so we said this was lateral here, and so this one that normally comes all the way down here and connects to the head of the fibula. What is this ligament called? Yeah, and since it's left, it's going to be left collateral lateral ligament.
Oh, you have to
Left,
say
no,
left.
left lateral collateral ligament. Yeah, we're going to ask you to include left or right.
Did you also call it the left fibular collateral down?
Even though lateral is left.
Left fibular collateral ligament is another name you could use for it. I kind of like those names too, because it's not such a tongue twister. But left lateral collateral, too many L's in there. Okay, and then this one,
Medial collateral.
Yeah, and remember what they said about this ligament? They said that it's attached, the left medial collateral ligament is attached to the fibrous capsule. And so what I'm poking out here, what I'm touching right here, is actually the joint fibrous capsule. And then this is the medial collateral ligament that's actually embedded as part of that. Except the collagen fibers go this way, making the ligament. Okay, now what I'm touching, what my finger is in the synovial cavity. And I'm touching the synovial membrane, and it's really slippery. All I can do is tell you what you need to do after I'm finished talking is actually get in here, open this up, stick your finger in there, and feel how slippery it is. Okay. And actually, this was in the freezer, and there's some little crystals of synovial fluid in here, and it's kind of sticky stuff because it doesn't just have water. It also has proteins and glucose and carbohydrates, which is glucose. Okay, so if we put a pin, and really look, when we pin these things, we might put a tag around the ligament, but look at what's being tagged, what's being pinned. Because sometimes people mistake, and we might be tagging actually the joint capsule and not even touching the ligament. You got to get in there and really look to see where the pin is and what it's stuck in. And if you're not sure, call me over and I'll tell you. Okay, now if we put the pin here and say, what is this superficial membrane called?
The fibrous joint.
Yeah, fibrous joint capsule. But if I put the pin on the inside and say, what is this internal membrane? Synovial membrane. So the synovial membrane is on the inside, the fibrous capsule is on the outside. Superficial. Okay, so let's go inside the joint now, and what is actually inside of the synovial cavity and is bathed by the synovial fluid? Well, the articular cartilages. Where the articular cartilages end, the periosteum begins. Okay, so the periosteum comes along here. Now we start with the articular cartilage. The periosteum is going to leave the surface of the bone and become the joint capsule. Okay, so that's where the periosteum separates there, and now it becomes joint capsule. This is one of the meniscal cartilages, right, the meniscus. And so this, pardon?
That's lateral.
And this is the lateral meniscus.
Left lateral movement.
Yes, left lateral meniscus. Okay, good. And so this one is actually bathed in the synovial fluid. Okay, now they said this one is not attached to the fibrous capsule. And so consequently, it's kind of more mobile here. Look at the medial. The medial meniscus is really, and I didn't take it off of all this. I took some of it off, and I really had to chop off that capsule, but the fibrous capsule is actually holding that and reinforcing that. So the medial meniscus is always more stable. This is the one that flops around more. Also, it's because this one in the human is more like this, and so because of that, it can move around more, whereas the medial is more separated and it's anchored more, because these are more spread out. Okay, so the lateral is a little more flimsy and moving around more. Okay, and you can really check it out on this. You can even slice it a little bit or whatever and see how really resilient that is, because that's its function, right? To do that, to act as a cushion. So we have those meniscal cartilages in here, in the temporomandibular joint, and probably in other joints of the body too, the ones that really have to endure a lot of force. Okay, and now we'll do the cruciate ligaments, and cruce means X. And so there's one that's anterior and one that's posterior, but it's where they anchor down on the tibia that's going to tell us if they're anterior and posterior. So this one, well, I'm looking posterior, so you might say, oh, I'm looking posterior, so it's the posterior cruciate ligament. But the reason is because it's anchored down here, and it does cross posterior, but it anchors to the head of the tibia posterior. But look at where it anchors on the femur. It anchors on the medial side of that intercondylar notch, and then on for the anterior, we get the best view. It's true anteriorly, so that's the anterior cruciate ligament, but it anchors to the anterior of the tibia. So that's really how you're going to identify anterior from posterior. Okay, let's look at the posterior first. So here I'm gonna touch it, and then I'll rotate this around so we can all see. So this is the posterior cruciate ligament. Oh, I have it upside down. Okay, so now we can see how it anchors onto the tibia posteriorly. You can edit that part out. Okay, so that's posterior cruciate ligament. Okay, but can we see the anterior? Well, actually, yeah, I'm touching it right here. Okay. The anterior we see right here. So you can see the anterior from a posterior view. See a little bit of it
We're
right here?
lucky on this one, though. I think
Well-
sometimes it's hard to,
Yeah, but you can really, yeah, and it's true, the best view is the anterior posterior. Okay, let's open this up, and now we can see which is the anterior, because it comes right here, actually. So here's the anterior cruciate ligament. And you might see it better when you move this around back and forth. But you do see quite a bit of the posterior cruciate ligament too. So here's the anterior cruciate ligament, but there's posterior. So be careful, look for how they attach to the tibia. Okay, now these cruciate ligaments are not exposed to the synovial fluid. They're actually excluded from the capsule. And so if you look, actually, if I took the femur off and we look down at a superficial view of the knee, let me trace. I wish I had a drawer, but I'll just use some little fluid here on the table. And so if I draw the synovial membrane, I'll show you. This is the anterior, this is posterior, medial, lateral. And so this is the synovial membrane, and then it comes like this. And this is where the two cruciate ligaments are, or actually like this, right? And then this is where the menisci are going to be, the meniscus. And then, so what happens is the synovial membrane actually goes around. So here's the synovial cavity filled with the fluid, and so it excludes, it goes around those cruciate ligaments. And then, and they showed you the synovial membrane separated from the fibrous capsule, and that's because the fibrous capsule just goes right here, posteriorly. It doesn't follow the synovial membrane here, so they can show you this little bit of the synovial membrane in here. I dissected that away, but it does go around inside there and then excludes these. Okay? Okay, any questions? Okay, so you've had this so much now, so just